And welcome to Chapter 9, the team approach to healthcare. This is where we're going to dive into what truly makes emergency medical services effective, and it's all about teamwork. When we respond to calls, it's really not just about how well we perform our individual tasks, it's about how well we function really as a unified team, right? This chapter really lays the foundation for understanding team dynamics in EMS, from communication and leadership to handoffs and collaboration with ALS providers. So one of the core takeaways here is that you are not working in isolation, right? Your actions are a part of a much bigger continuum of care. From the 911 dispatchers to EMRs, EMTs, medics, nurses, and physicians, every provider really contributes to that patient's journey. Our job is to integrate smoothly into that continuum and ensure that we enhance the patient's outcomes, not disrupt it. One thing we're going to talk about is the EMS agenda of 2050, which we hit on in Chapter 1. But this really challenges us to create systems that are inherently safe, not only for you, but for the patient and for the team. And to do that, we need more than just clinical knowledge. We need a culture of safety built on collaboration, respect, and accountability. And that's really where this chapter begins. So let's go ahead and talk about the core competencies that we're going to develop throughout this chapter, and we can break them down. First, you'll learn how to apply fundamental knowledge of patient safety, right? This means understanding how every action you take affects both the safety of the patient and your fellow responders. It's about making decisions that prioritize safety without sacrificing the quality. Next, we'll look at how to really properly transfer patient care. This is one of the riskiest points in the continuity of care because the information can get lost, repeated, or misinterpreted. All right, so a strong structured handoff can be the difference between a good outcome and a bad one. And then finally in this chapter, we're going to build on your ability to function within a team, how to interact with others in high stress situations, maintain effective communication, and respond to really dynamic team structures. So whether you're working with someone you've known for years or jumping into a crew that you've just met, your ability to adapt and to communicate is going to be essential. Now, these competencies, again, aren't just theoretical. They're what you'll essentially use on every single call of your career. So let's talk about it. So as an EMT, you are the gateway essentially to the healthcare system. You're often the first person to lay hands on that patient, the one who brings really the medicine to the person's home, to their car, or to the street corner where they collapsed. So you're going to play a vital role in stabilizing patients, gathering critical history, and beginning the interventions that could potentially save their life. But being part of this EMS system means you're also part of the team that spans the entire continuity of care, right? So from the first contact all the way to the patient being discharged. So you just have to think about that. Now, every moment you're on scene, you're part of a larger process, right? And your actions will impact what happens next. Whether the emergency department gets a clear picture of the patient's condition, whether the paramedic has the support they need to intubate, whether the critical details are actually handed off correctly. So this is why EMS systems are increasingly focused on creating a just culture, okay? An environment that balances accountability with learning. In this just culture, we recognize that mistakes can happen even with good intentions, right? So instead of punishment, we look at how to improve the systems, provide coaching, and prevent a reoccurrence, right? So this shift is part of building a culture of safety, a place where providers really feel safe to report near misses and speak up when something doesn't feel right, and essentially just continue to grow. So now let's talk about where EMS is headed, right? So we're in an era of essentially what we call an era of team healthcare. So gone are the days of a lone EMT handing off a patient to a nurse and just walking away. We now understand that the real measurable improvements in a patient's outcome happen when everyone works together, from dispatch to discharge. So take community paramedicine and those mobile integrated healthcare systems, right, as perfect examples. examples. These are advanced models where EMS doesn't just respond to emergencies, they manage chronic conditions, perform follow-ups, and deliver preventative care. Okay? This requires really deep collaboration with hospitals, clinics, and social services, which means more than just communication. It means more coordination and more trust. But here's the catch. So EMS systems are going to vary. So one region might actually have full-time EMTs and paramedics working side by side every single shift, while another might rely on volunteers or a mixed crew kind of model. That variation means we need to be intentional about building team dynamics every time we step onto a scene. So whether you're walking into the scene with familiar faces or total strangers, your mindset needs to be, how do I become part of a team right now? And that's really the focus of this chapter, helping you develop the awareness and the tools to join, to lead, and to strengthen a team no matter the situation. So let's break down the different types of teams, right, that you're going to encounter in EMS. The first is are the regular teams, right? This is the crew you work with consistently. You know their habits, they know yours, and you build a rhythm over time. You can anticipate their movements, communicate more efficiently, and often don't need to say much to start getting things done. This familiarity really enhances patient care because your teamwork is just so seamless. But then there's temporary teams, right? So these are the crews formed on the fly at a multi-agency response, a mutual aid call, or during special events. You might be working with someone you've never met before. In those moments, your professionalism and communication skills are what carry the team. So you need to quickly assess each person's capabilities, clearly define roles, and trust each other despite a limited history together. Both teams are really common in EMS, and being adaptable between them is a hallmark of a strong provider. So when you train, you need to train like you'll be placed in either scenario, okay? Because one day you will be. Now let's explore some special teams, right? These are not your everyday 911 response crews. They're special teams that are built around unique capabilities or highly trained individuals, and they often operate within a larger emergency or public safety system, okay? So here are some of the examples. We have fire teams. They're pretty much going to handle fire suppression, scene safety. We have rescue teams that specialize in vehicle extrication, technical rescues. Hazmat teams, which manage hazardous material incidents. A tactical EMS team works alongside law enforcement during high-risk operations like an active shooter event. We have special event EMS, which provide medical coverage, at concerts or sporting events. EMS bike teams are common in kind of large crowd settings for quick mobility. And then we have the mobile integrated healthcare, the MIH teams, right? And in-hospital patient care technicians, both of which are evolving rapidly in the modern systems. And as an EMT, you may be called to assist or even integrate with any of these teams. So understanding their functions is going to help you support their mission while continuing yours, and that is to deliver high quality patient care. It also shows the vast career pathways that EMS can lead to. So here's a concept that's really easily overlooked, but it's really very, very important. So groups are not the same as teams, okay? So a group is specific to EMS, might be several providers gathered at the same scene. But if each person is working independently, say, one person is splinting a leg, another starting an IV, and no one's talking to each other, that's just a group. There's no coordination, there's no shared strategy. This kind of fragmented care can result in serious gaps, like a patient arriving at the hospital with perfect splints, but a mismanaged airway. That's not really a success. That's a failure dressed in technical proficiency. So on the flip side, a team is interdependent, right? So it's built on collaboration, communication, clear leadership. The difference in patient outcomes between a group and a team, it can really be life or death. So the next time you're on scene, ask yourself, are we working as a group or are we working as a team? Now, let's kind of dive a little bit deeper into this idea. So again, the team. So a true team in EMS consists of providers who are assigned a specific role, working in a coordinated, interdependent way, all under a single designated leader. Everyone's action supports the common mission, and that mission is the best possible patient outcome. Okay, so think about an easy one. Think about CPR. If the person doing compressions knows their exact role, the person handling the airway is perfectly in sync, and the team leader is timing the rhythm checks, everything just clicks into place, right? And that's really what a real team looks like. So it's not about rank, it's not about who has the most certifications, it's about who is doing what and how well we work together, okay? A good team, it's also important to know, a good team isn't just fast, right? It's efficient, it's safe, it's fluid. It's able to adjust to the changing patient needs without losing that cohesion that it's built upon. So that's really the standard we should strive for every time we roll out the door, okay? Now, to really understand how a group can evolve into a team, we need to look at the 5 essential elements of a group, right? So these aren't just like random buzzwords or terms. These are what help bind individuals together into a functional unit, right? So first, there has to be a common goal, right? In EMS, that goal is almost always centered around the patient, whether it's stabilizing them, improving outcomes, or just ensuring a safe transition of care, or all 3. So secondly, members must see themselves as a group, not just a bunch of individuals who happen to be on scene. That shared identity really builds trust and accountability. Third, there must be a sense of continuity. This doesn't really mean you'll always work with the same people, but it does mean understanding that even temporary groupings have the potential to work together again. That perspective is going to encourage professionalism and consistency. Fourth, we need to have shared values, right? A mutual understanding of how we want to get the job done. Maybe it's valuing safety, compassion, or just having a high standard of care. When everyone's on the same page, the mission is going to flow much better. And then finally, there must be different roles within that group. So these don't have to be formally assigned, but everyone should naturally take ownership of the piece of puzzle, okay? When all this comes together, a group can be a high-functioning team. Now, understanding group behaviors is critical in EMS. And this slide, it breaks it down into 3 specific models. You have dependent, independent, and interdependent, okay? In a dependent group, individuals wait to be told what to do, okay? They rely heavily on a supervisor or some type of leader for every single decision. While this really might work in a highly structured environment, it's a poor fit for emergency scenes where adaptability is key, right? Then we have independent groups, okay? This is where each person handles their own tasks without coordinating with others. You'll see this happen sometimes in very chaotic scenes, right? Everyone is technically helping, but no one is communicating. It can lead to duplication, omissions, or worse, just unsafe care. So imagine like a patient getting 3 IV attempts while no one checks the patient's airway. So this is how that happens, okay? Now what we really strive for in EMS is for it to be an interdependent group, okay? And that is the true team, okay? Here, everyone works together, shares accountability, and communicates in real time. Okay, there's a shared responsibility for the overall patient's outcome. If someone falls behind, someone else is going to step in. And that's what you want to really be a part of in these very chaotic and high stress situations. Now that we've essentially laid out the foundation, let's talk about what makes the team perform well, right? So there are 5 critical elements that define an effective team in EMS. First, there must be a shared goal, typically delivering the best patient outcome. Everyone on the team must be committed to that goal above all else, okay? Next, you need to have real clear roles and responsibilities. Who's doing compressions? Who's managing the airway? Who's gathering the history? The clearer these roles are, the smoother and safer the call will run. Okay. Then third, the team should have diverse and competent skill sets. Okay. You might be the one who's great at calming the patient, while your partner is quick with equipment setup. Diversity itself is a strength when each member brings their best, and respects what the other can contribute. Fourth is effective collaboration and communication, right? So we're talking closed loop communication, respectful corrections, and real-time updates as the situation actually evolves. And then finally, you need supportive, coordinated leadership. Not just a boss, but really a leader who facilitates team function and will adjust the roles as needed, okay? And we're gonna break these down even further in the next few slides, right? So as we build on those specific elements, let's bring it back to two advanced concepts, right? So we have CRM, which is crew resource management, and situational awareness, okay? So now when we're talking about crew resource management, CRM is a system borrowed from aviation, and it's adapted to EMS. It's going to empower team members to essentially speak up, identify threats to safety, and support each other without undermining the chain of command, okay? It helps prevent errors and ensures that everyone has a voice, even the newest EMT on scene. Part of the CRM is using tools like the PACE mnemonic, okay? So when something feels off, utilizing the PACE mnemonic is gonna help mitigate that situation. So let's break that down. So P stands for probe. Ask a question or make an observation. A, alert. Bring attention to a developing issue. C, challenge. Respectfully offer alternative courses of action. And then E, emergency. If needed, escalate immediately to stop a dangerous act. Okay, all of this ties into what we call team situational awareness, right? A shared understanding of what's happening around you, and what's happening around you, and what are the patient's needs, and what the next steps are. When everyone is dialed in, you catch problems early and you can adjust quickly. That's what turns a group of EMTs into a high-performing team of EMTs. Now, transferring a patient care. So transferring patient care is really, again, one of the most critical handoffs in EMS, and one of the easiest times for errors to happen if we're not deliberate and precise. Think of like a baton pass, right, in a relay race. If the pass is smooth, the team is gonna move forward. If it's fumbled, valuable time and momentum are lost. And in our world, that can mean the difference between life and death or debilitating injury. So there are 5 key guidelines to ensure a smooth transfer, okay? Number 1, uninterrupted critical care. If the person giving report is also doing CPR or managing the airway, hand that task off to someone else before giving your report. Makes sense, right? Then number 2, minimal interference. So try to choose a place and time where the handoff won't be disrupted by crowding or movement. Then we have respectful interaction. So respect all members of the team, including those from different agencies or different ranks. Establish common priorities, right? Focus the entire conversation on what's important, and that's going to be the patient's condition, the treatments that were provided, and what's needed next. And then we need a common language or system, okay? So use a structured format like the SBAR or MIST or the SOAP note. So SBAR is situation when you're actually like doing that handoff. Discuss the situation, the background of the patient, the assessment, the plan or recommendation. Or MIST, you have the mechanism, injury, signs, symptoms, treatments, right? It's just a structured way to provide information about your patient. And then again, don't forget to make eye contact, do your best to eliminate distractions, and ensure that the receiving provider has understood the report, right? You're not just transferring a patient, you're transferring the responsibility. BLS and ALS providers working together, right? So too often in EMS, BLS and ALS providers are viewed as operating on different levels, okay? But in truth, we are two halves of the same system. BLS care doesn't stop when ALS arrives, and ALS doesn't override BLS. Okay? Instead, we integrate our efforts across the continuum of care. So let's use again cardiac arrest as a good example. Okay, high quality CPR and early defibrillation; those are BLS skills. Okay, and they're absolutely foundational. Everything that ALS does builds upon that foundation. So intubation, IV meds, rhythm interpretation, none of that matters if compressions and airway support aren't already being done well, okay? So as an EMT, your role is to continue doing what you do best and also to support ALS providers by prepping patients, gathering histories, managing equipment, and recognizing when something isn't right. Now, in some systems, you may even perform skills considered ALS in others, okay? But always know your scope of practice, okay? Understand your local protocols, and most importantly, communicate clearly. Great pre-hospital care really depends on that seamless coordination between BLS and ALS providers. And then during lab, we're gonna kind of dive deeper into what type of BLS, what an EMT can do to assist ALS, and we'll talk about that during lab. And we're gonna actually like practice it, right? And this is kind of what we're talking about. But yeah, so there are many ways that EMTs can specifically assist with advanced procedures. So even when the skill itself is outside your scope of practice, okay? The key here is understanding the 4 phases of assistance, okay? Patient preparation. You might help position the patient, provide BSI and PPE, or gather the patient's consent or history, okay? Equipment setup. You anticipate what your paramedic partner might need. Set up an IV bag, prep the intubation kit, or ready the cardiac monitor, right? Performing the procedure. While you won't intubate or push meds, you can assist by holding tools, handing off supplies, or managing ventilations during the actual procedure. And then lastly, continuing care. So after the procedure, you may help monitor the patient, secure devices, or just document what was actually done. So knowing the procedure and understanding your supporting role makes you a better team member and overall a more valuable one. And remember, just because you're not doing the procedure doesn't mean you're not saving a life, okay? Often the person holding the BVM or prepping the IV bag is just as critical as the one inserting the actual tube. So now let's go ahead and go into critical thinking and decision making in EMS. So now what really separates the average EMT from an exceptional one is that critical thinking concept, all right? EMS just isn't about performing skills. It's about knowing when to act, why you're acting, and how to adjust when things change. So effective decisions come from 3 things: sound, up-to-date knowledge of protocols and pathophys. Accurate assessment data, and that's going to be gathered from your history, your physical examination, and the scene evaluation. And then the ability to really synthesize that information to determine your next steps. This is especially important in really high stakes or low frequency situations, things that you don't see often but must get right when you do, okay? So decision making begins before you even arrive on scene, right? And it's gonna continue as you reassess the patient. And it doesn't really end until the call is fully complete. So great EMTs don't just react, they anticipate, they evaluate, and then lastly, they're gonna reflect, okay? So the next few slides here, we're gonna walk through the actual stages of that process, but really the bottom line is good care doesn't come from going through the motions. It comes from thinking critically every single step of the way. So again, let's talk about the 4 stages of the decision-making process in EMS, okay? So think of this as your mental roadmap during every call, okay? We start with pre-arrival. So your critical thinking really begins the moment dispatch information is received. Start thinking, what equipment do we need? What's the possible mechanism of injury? Are there any special considerations based on the patient's age, the location, or the complaint? Use this time to really mentally rehearse possible interventions and role assignments. Then you have arrival. So as soon as you step out of the rig, your scene size-up takes over. Identify hazards. How many patients do you have? Determine whether you need additional resources. This is also where you begin your initial impression, okay? So what you see, what you hear, what you smell immediately helps you prioritize your care. Then during the actual call, this is where the rapid assessment, your vitals, history taking, interventions all come together. You're constantly gathering new data and asking, is my current plan working or do I need to adjust? This is where teamwork and communications are vital, right? Share findings, listen to input, and update your plan as needed. And then lastly, after the call. So once the patient is transferred, take the time to reflect. What went well? What could we have done better? Informal debriefings help us improve, and structured reviews after complex calls help the entire team grow. So never really skip this step. It's where good EMTs are really going to become great ones. So even the most experienced EMTs kind of fall into what we call decision traps, right? These are patterns of thinking that can lead to serious errors, and if we're not aware of them, okay? So let's look at the three most common, right? Bias. So this happens when you make assumptions based on the patient's appearance, their history, their lifestyle. An example, like assuming someone who smells like alcohol is just drunk. And then they miss a brain bleed, okay? So bias really shuts down our curiosity, and it's gonna narrow your thinking, okay? Then we have anchoring, okay? So this is when you actually latch onto the first piece of information you get and don't ever adjust your thinking. So even as new evidence comes in. So it's like assuming a patient with asthma is having an asthma attack, okay? When they're actually, in anaphylaxis. So anchoring is gonna blind you to the full picture. And then lastly, we have overconfidence, right? This is obviously dangerous. It's when you think you know more than you do, or when you stop listening to your partner's input. Overconfidence can cause you to miss changes in a patient condition, skip steps, or just ignore safer alternatives. So to avoid these traps, you need to stick to a structured, consistent assessment and always double check your assumptions, right? Encourage your team to speak up and make it safe for them to do so. So great care really requires great humility. And then lastly, as we kind of end this fairly short chapter, it's a short content chapter, but again, it's something that's going to be imperative in the field, okay? Because you're going to be working with other healthcare providers throughout your entire career, not always as an EMT, but as you progress in your careers, everyone is still a part of that same team, okay? And now with that comes conflict, right? It's going to be impossible to go your whole career without not experiencing some form of conflict. It really is inevitable, okay? So when you're working in these high stress, these fast-paced environments with strong personalities and limited time, right? But how we handle this conflict determines whether it's gonna derail the entire call, or is it gonna strengthen the team? So here are 5 techniques for really managing conflict professionally, and that's really the key, is professionally. So one of them is the patient should always come first, right? Always. If a conflict isn't directly impacting patient care, park it until later, right? Your priority is the person lying on the gurney, okay? Don't engage, right? If someone is getting heated and it's not a safety issue, don't take the bait. Stay focused, just take a breath. You don't win by being right, okay? Especially during a patient encounter. You win by delivering excellent care. Then keep your cool. So if you must address something, you just need to do it calmly, right? If the issue is urgent, such as a safety concern, use tools like the PACE model, again, to escalate appropriately. Then we want to separate the person from the actual problem, right? Focus on the behavior, not the actual personality. Saying we need to slow down compressions is far more effective than just saying you're doing it wrong, right? And that's where that constructive feedback aspect comes into play when we're talking about team dynamics. And then again, choose your battles, okay? So not every disagreement is gonna be worth your energy. Ask yourself, does this affect patient outcome or safety? If not, just let it go and just debrief later, okay? So that pretty much brings us to the end of this chapter. So it's a short and concise chapter just about working as a team, not as a group, not as a solo individual, but understand that you're a part of a larger picture with that one main goal, and that is the patient's outcome, right? Doing what you can to have the best outcome for that patient. So that does it for us. I hope you enjoyed, and I will see you next time.